Hello and good afternoon. Today I'll be talking about the prevention of Tommy John. Many pitchers today in all levels of baseball have experienced the pain and burden of a UCL tear. The ulnar collateral ligament is a tendon connecting the humerus to the ulna and can encounter a stretch while throwing a baseball at a high velocity. The number of Tommy John surgeries, UCL surgery, per year is on a constant rise. Although the number of surgeries continue to increase, with the right precautions, a tear of the ulnar collateral can be avoided. As founder of Driveline Baseball, Kyle Bodie says, single pitches do not rupture ligaments and cause elbow injuries and Tommy John surgery. The UCL is torn microscopically over time in a flawed pitching delivery. A clean arm action and efficient pitching delivery are one of the many things in baseball that can be greatly overlooked. A clean arm action can distribute the stress of throwing throughout the arm and the body. One of the most common mechanical flaws that can cause injury to the UCL is forearm flyout. Forearm flyout occurs when a pitcher's forearm is outside the elbow when throwing. This flaw can put a great deal of stress on the ligament and can cause micro tears throughout a pitcher's career, ultimately causing the ligament to rupture. This may make it seem as if the rupture happened all at once, but in reality, the injury has been occurring over a long period of time due to throwing with an insufficient arm action. When these flaws are assessed, they can be corrected, thus creating a more efficient arm action and making the athlete less prone to injury. Another way to reduce the chance of injury is to increase strength levels. Bodie says strength training has a positive benefit on injury prevention as well as performance. It is very important to build up the muscles surrounding the UCL as they protect it. The triceps and wrist flexors pronator act as a dynamic stabilizers during delivery. The UCL alone cannot withstand the strain of throwing a baseball at a high velocity. The surrounding muscles, such as pronators, play a vital role in the prevention of a UCL tear. Injuries can also be linked to overuse of a pitcher throughout a season or even game. It is very important to keep a pitcher's pitch count and to not let him exceed the pitch limit due to it putting him in a higher risk of injury. Stan Conte, a former trainer and physical therapist for the Dodgers, states that fatigue seems to be the underlying issue in most Tommy John surgeries and injuries, and younger arms fatigue more quickly. It is very important to keep arms as well rested as possible, along with them being on a pitch count that should be enforced. As an arm gets fatigued while throwing, the mechanics start to slag, making the pitcher more prone to injury. As orthopedic surgeon Dr. Kane says, you have to have an off-season. Many pitchers have already had Tommy John surgery, and for those, the chances of having a second are very high. The reason so many pitchers have multiple surgeries is due to the fact that many of them do not change anything with their strength levels or arm action. Common sense will tell you that if a pitcher continues to have the same flawed arm pattern that injured him in the first place, that it will likely happen again. It is vital that athletes assess themselves and make corrections to prevent the injury from reoccurring. Another mistake many pitchers or other athletes as well make is trying to come back too early. A pitcher's competitive nature may drive them to shorten the recovery time in hopes of playing sooner. It is very important that a pitcher take the suggested amount of time to recover and to not rush the recovery process. A rushed recovery process will come back to bite them in the end, with another injury resulting in another surgery. A pitcher should always be sure to take it slow while recovering and not push their body to the limit. The use of steroids in some college and professional athletes may also play a role in the rupture of the UCL. The UCL is a ligament connecting the humerus to the ulna making it very important for the ligament to be strong. American Academy of Orthopedic Surgeons states that anabolic steroids may weaken your tendons. The tendons in the elbow may weaken, causing the UCL to carry more of the workload, putting in a high risk for injury. In closing, a pitcher should focus heavily on having a clean and healthy arm action, build up the strength levels of muscle surrounding the UCL, keeping a close eye on the pitch count, and staying away from anabolic steroids. With the right precautions, a tear of the ulnar collateral ligament can be avoided. Thank you for your time.